Gerry Naughtin is my name. My title is Strategic Advisor, Mental Health. And so in that role within the NDIA, within that role, my role is to give advice to the board, to senior management, to staff across the organisation about some of the strategic issues in relation to mental health. The other part of my role is to work with stakeholders across the country, to be listening to the sort of issues, to be making sure I'm gathering those together and feeding them back from the organisation. It's been great. This is that Mari's interviewing me at the end of a 2-day national conference, and we've probably a bit tired because we've had a great talk fest for the last 2 days. But this has been, again, the sort of role of how we start to... My role is very much trying to reach out and bring that information back in and help people to understand and how to bring it in to improving the way we work with people with mental health issues across the scheme.
Well, I'm presuming your role was in part responsible for the government's response last month, which is a new psychosocial approach to the NDIS, which was in response to what the Minister today said, where the NDIS had missed the mark for people with significant mental health issues. Where had you missed the mark?
Last year, in October last year, way before I started, the NDIA board, listening to feedback, so that was a new board that had been in place at that point for about 9 months, said we're hearing a lot that things aren't as good as they should be and we want to know more. So they're, I think, a very switched on contemporary board, and I think they've got a new management team at the time who are also saying we're hearing these issues, how do we stop and listen to them and make sure we're addressing those issues? So what we did is we held 13 consultation meetings across the country. We invited Mental Health Australia to partner with us in that process, and so we tried to invite people and have a listen to that. So what were the issues that they identified? I think that there's some big themes. First of all, one of the strong lessons was the staff that we had working with people in planning did not have sufficient knowledge of psychosocial disability. And so what's been very clear is in the recent announcement, we have announced the rollout of specialist planners for psychosocial disability. And that's part of a much broader initiative that the government's funded with some very significant new money to allow for the employment of more staff and more training. And what that's going to mean is a couple of elements of what that means. At the front line, for participants, there will be more staff who will have specialist experience in psychosocial disability, so that people coming for planning sessions, families and carers, can, I think, expect that when they come in to see or have staff going to them, that they will have much more knowledge and information and skill in relation to mental health. And I think we'll be able to hold those conversations and be able to listen more deeply and respond to some of those issues. So that's been a really important initiative, and on October the 10th, Ministers Fletcher and Henderson announced that new initiative. The other suite of initiatives for participants was people clearly wanted majority of people wanted a face-to-face session. So we had experimented with telephone interviews, and I think very strong feedback that the face-to-face was really important, both for people with psychosocial disability, but generally across the scheme too. The other areas, better information. So really strong focus to say, to help us, there's so much change going on and there's a lot of anxiety, and what people were asking for is help us to understand what you're offering. And so one of the switches in this was, instead of us thinking we've got this bright new national social policy that we've all heard about, we really started to understand we need to take that back and explain it to people. Explain it to people who are thinking about applying for the scheme. explaining it to general practitioners, to health professionals, to families about what was this scheme. And we use terms like insurance. What does that mean? And
sorry to break in, but there are also a number of other big picture issues that people bring up. Long delays in being able to appeal or review plans, where the model doesn't really work for mental health, where sometimes people get a big plan to start with, but then they present the next time and everything seems okay, so it's stripped away, but that actually takes away the support that allowed them to be so stable. The issues around thin market supply, particularly in remote areas and in areas of great complex need, those sorts of things. Are we seeing new plans for those things too?
So, Mari, we are, and so I think in saying that, this initiative was announced on the 10th of October, Mental Health Day. So there's a clear commitment to rolling that out from now. And so what we are seeing in South Australia, in Tasmania and the ACT is we are already starting to deliver training programs for the NDIA planners and for the local area coordinators. We will have a progressive rollout of those specialist positions that will have two elements. One is within the scheme itself, we have many staff with psychosocial disability experience. So we'll be bringing those together much more, as well as recruiting external people who have that psychosocial disability experience. The other issues are clearly this issue of delays in terms of getting plans approved. And again, one of the significant things of the government's new financial commitment, it is allowing us to employ more staff. So it's increasing our staff ceiling to mean that we've got more staff to get through this workload. And just to try and give your viewers a sense of the scale of the issues, we've got what we think is 40,000 people to admit into the scheme in the next 18 months. That's a lot of first plans, and a lot of work in terms of...
These are 40,000 people with psychosocial disability, as is described.
Psychosocial disability is still to come into the scheme. Based on this notion that we'll have 64,000 people with psychosocial disability in the scheme, which is the best estimate. It is an estimate.
And an arbitrary one.
And there's much discussion about who else should be dealt with. Much as I think as we've heard in the last couple of days. But one of the focuses for the agency is we've got government set us targets, and the federal ministers and the state and territory ministers have set us clear what's called bilateral targets of bringing people in. And so that's really important to make sure we're responding. So our staff who are doing planning are working very hard to be able to sit down with people and work through their plans. And what I think was terrific to hear in this conference is the feedback from so many people, I think over this last 12 months, of saying, actually, these plans are getting much better. Their experience with the agency is really improving.
The overwhelming thing we've been hearing is people understand that it's a big new thing, that it's going to take time, that it will be flawed in many ways. But in the meantime, people whose plans aren't working out how they expected are being often harmed and put at risk, and that there's a big group of people who are not going to be eligible, who may, because of a lack of community supports that have now dropped away as a result of the transition, who may end up coming into your, pushing your 65,000 figure out much wider. How does the NDIS manage that?
So it's really important to say the NDIS, while we talk about 64,000 people, the NDIS and the legislation is very clear about saying anybody who meets the criteria of severe, persistent mental illness and has, if you like, functional impairments is the technical language, or disabilities associated with that, and is deemed eligible. And what we ask for is evidence from that person's treating health professional. So if they say they're meeting the criteria, that's really part of the process we use to confirm their admission. So if we get to 64,000 and someone meets the criteria, we will still be accepting them.
And of course, the big issue is that a lot of people can't meet the criteria. For example, people in remote areas or people who can't afford doctors, etc., actually can't even deliver that for you. Are you confident that your systems are going to be able to meet those needs?
So what we're saying is, I've worked in mental health for now 10 years, and the current systems has never met all needs, and particularly in rural, remote areas. We've had numerous reports. Now, what we would say is there is no magic wand in this. We can't come in and say, oh, NDIS here, we've got the solution. What we are doing, and particularly if we deal with rural, remote areas, is actually going into communities where there are gaps and talking to those communities about what can we do.
Could you give an example of that?
So one of the examples, our staff in Western Australia recently met with the Aboriginal controlled community health organisations and talked to them about what does the NDIA mean in your communities, and does the notion, and particularly in some of those smaller communities, how does this work with your existing services? So instead of taking what is a city model, which is presuming there's lots of providers for people to choose from, what we've understood is we need to actually stop and think about how we work with them. So that's a good example. And the point I'd make is what I think the board of the agency, the senior leadership, our state and regional teams are very much on about is how do we get this scheme to work? And I think that's the real focus of the agency at this point.
Sorry if I can break in, there was a lot of talk about targets in our last panel session, but given that you've now come up with this new pathway, the psychosocial pathway, how will you know that you're on track with that? How will you measure that you actually have fixed up those things that have been causing such problems to now?
So there's several points around targets. The target that we is set for us at the moment is this figure of 64,000 across the country, and then there's specific targets in each state and territory. And so what we're clearly doing is wanting to make sure that we are two things. That people are informed of and aware that the scheme is there for them, that they have the option to apply if they want to. Secondly, there's a lot of work with state and territory governments and the agency tracking how that is going. And the other part, I think, of the work, particularly out of Mental Health Australia, one of the big learnings that we're talking about before, is this situation. What we're understanding is we will need to outreach to many people. But the notion we had early on in the scheme was, we'll set up our system and you need to come to us. What we're understanding is, for many people with psychosocial disability, often relating to a large government bureaucracy is very, at times, traumatising and threatening. And so one of the issues we need to look more closely is how do we outreach much more? And our local area coordinators, that's part of the role that they are funded to play, is to be able to reach out. So one of the notions how that might work, if there's a clinician working with someone or a family person who's concerned that they think the NDIA might be able to help someone, but that the person themselves doesn't want to apply, that there might be a simple process of ringing the local area coordinator saying, could you come out and meet with this person just to explain what the scheme's about?
Is that process in place now?
That process is in place, but we're wanting to strengthen that and give that greater focus. And I think particularly be clearer about that's an expectation that people can ask the LAC for that. And I think for many people, they don't see that is the role. That they think, oh, I could go to them and ask them to help with that. So that's some of the work in terms of rolling that out, talking with our LACs, and making sure where we're identifying people. So one of the areas, for example, we are doing at the moment is talking with people working in the homelessness sector, because we know many people who are homeless will be eligible for the NDIA, and saying how can we work with the homelessness services who have that contact with people, and then see how our partner organisations, our LAC organisations, can work hand in glove so that we can get better systems working together to make sure we offer people. Now, the other point I make, and we've had this discussion at the conference, this is about offering people the service, and they're making a choice to use this service, and that's a really important thing. And some people are choosing not to use it, and that's fine. But the point, I suppose, we think is this is this idea of an insurance scheme. It's there when people want to use it and feel they need this service. And so one of the concepts of this scheme, and I think this is perhaps part of the issue about how we understand this, because in many ways we've had quite rigid services and quite set volumes or hours of service in many of programs like particularly FAMS and some of the state programs. The concept we've got here is we want to invest in providing the level of services people need to manage the psychosocial disability issues that they have. And that, if maybe people are in the scheme for a few years, they get better and move out, but need to come back in at another stage. So there's a whole flexibility in the way in which we're designing this scheme.
Is there a model or an area where you really think you've actually made it happen? Where's the success story in the NDIS in mental health?
One of my favourite success stories, and this reflects in my early days of my career, I did a lot of work in boarding houses, what we now call special accommodation or supported residential facilities or services. And one of the great, there's two success stories. What I think we're seeing is many of those people, they're private entities, have had very little opportunities to do other things outside that facility, and often live very much in an isolated ghetto. In Western Australia and South Australia, because of work by the agency staff, we're seeing a significant proportion of people, over 75%, being eligible and actually going out in the day. And there's a lovely story I tell, if I can just share this with you, Murray. There's a guy in Melbourne who never got out of bed before 11 o'clock in the morning, had no money to go out. And one of the things he wanted to do was to go fishing. So what the scheme has done is it pays for a worker and the hire of a little runabout boat. And he goes out fishing one day a week. And for him, that's changed his life. He's up in the morning, he's organised, he's got, but it's, in a sense, that flexibility of saying, instead of you can go to a group program or go to a centre, he doesn't want to mix with other people. He really wants a companion to go with him who's a fisherman, and they spend most of the day out fishing.
Can I ask though, is it important to you that person, that companion, has specialist mental health skills?
So it's important for the participant to decide. Generally what people look for is compatibility of personality. What I think, again, and what, for the scheme's perspective, it is about what choice that person wants. Now, within the pricing schedule, the participant can choose at a lower level, a standard level, or a more complex level in terms of the level of training that that person might need. Now, so I think, again, this notion of what does the scheme think is probably being replaced as what does the participant feel is important. And often it's those interpersonal issues, age, etc., that getting on with someone is actually a pretty important part. So for this guy, it's someone who liked fishing. And it wasn't about liking, having good mental health training. It was he good at fishing? So I think it's an interesting part of the change we've got going on in the scheme.
Given though that there are still those many concerns, and for example the physical health of people with mental health issues, whether that should come under the NDIS or stay in the mainstream, that's still there. There's a whole bunch of other issues. What is your next priority for reform for psychosocial care? So the next priority for us is what we have agreed is we want to work closely with the sector through the Mental Health Australia as the national peak
on a range of recommendations for reform to the pathway. We've announced a series of reforms that we're putting in place now, but we know there's more that has to happen. So over the next 6 months, we're going to work with Mental Health Australia and other people around a range of projects that have been identified, and those areas, if people are interested, are on the Mental Health Australia website. It's NDIS, the Psychosocial Disability Pathway, which lays out what is an agenda of issues that we're going to work through. For us, building the workforce capacity, providing better information to participants, to family and carers. I think the other message we've got is we need to be more family and carer responsive. So part of this next phase of design work is working with Carers Australia, Mental Health Carers Australia, in thinking about the reconfiguration of some of our processes and our language to make sure it's far more inclusive for families and carers. The other area that I think that has been raised for us is issues around pricing. And so there's a lot of work within the agency going on around pricing.
And by that you mean that a lot of the specialist services can't compete. Basically, they can't provide services at the prices that the non-specialist agencies can.
So what that's meaning is across the disability sector, there's issues been raised about the current pricing levels, particularly in relation to attendant care. So the agency has done a major review. It's used an external consulting house and produced what's called the Independent Pricing Review. The board of NDIS has accepted the recommendations of that independent review and is in the process of implementing those now. So there will be some announcements in relation to complexity, in relation to attendant care, but we're also wanting to clearly address some issues about going forward, are there particular specialist requirements within the pricing guide? For some of those issues, it's about helping providers and participants to understand what's already in there and how that can be used more flexibly, because I think some of the provisions and the flexibility that's currently there is not being used enough. But I think we're also wanting to work with the sector to say if there are issues about special costs, we want to have a look at those, because we want to make sure that the services that we are funding, participants who are then buying services and providers, are able to meet those the needs of people. So we're not wanting to dumb down services, but it is also saying what is it participants are looking for, not just what providers have historically provided, is the point I'd like to make to your viewers.
And one final question, if I may. What is your takeaway from this 2 days of talking about NDIS and mental health?
Ari, it's been a really good conference and a really amazing discussion of 700 people from around the country. And my big takeaway is we're on the right path. We're on the right direction. That I think people are saying there's so many examples of really life-changing things that are happening to people because of the NDIA. It's saying we've got some issues that we need to keep working on, and we're committed to doing that with the sector. So for me, I actually take away a lot of encouragement and optimism that a lot of the work that the agencies put in, and we get a lot of criticism, but one of the things I see as advisor is the extraordinary dedication of people to try and make these things work. And so what I see is, and I'll be taking back to the organisation, will be, I think we're getting it, guys. People are saying really positive things about what is happening in this scheme, and we need to keep working. But I think it's really important to give encouragement and support to that 2,500 staff who are working, trying to help people to build, lives.
A good way is not to give them a flawed system to work with, isn't it?
It is, and I think that's what we're trying, again, to make sure that we address those issues and we move forward. And, I think it's one of the things, and I think you've heard this too in this conference, this is a big bit of change. It's not going to happen overnight, but we need to be on a journey to getting there. And so I'm feel really encouraged that that is part of what we are seeing.
Thank you very much for your time at the very end of a
Pleasure,
very long
Murray.
conference.